Come to what is dependence as per WHO. State arising from repetitive, periodic or continuous use of drug. Then all type of detrimental effect to himself, family, society and career. So drug is being used periodically and repetitively and it is producing detrimental effect not only to the individual but to the society as a whole. All grades of craving. Craving মানে need. ঠিক আছে? Then all type of psychological and physiological need to continue with the use of drug for the fear of getting distressful withdrawal. যেটা নুরুদ্দিন বলছিল, there may be distressful withdrawal. So let's come to DSM-5. DSM means Diagnosis and Statistical Manual. দুজন চলে এলো। Diagnosis and Statistical Manual for Mental Diseases. 5 is 5th edition. ঠিক আছে? এই DSM-5 typically used in psychiatry. So substance abuse, for substance abuse there are 11 criteria. ঠিক আছে? The criteria গুলো কি? Taking substance in large amount or for longer than meant to. Then wanting to cut down or stop using the substance but not managing to. তো বন্ধু কোথায়? বন্ধু কোথায়? ঠিক আছে। Spending a lot of time in getting, using or recovering from the use of substance. Craving and urges to use the substance. Not managing to do what you should at work, home or school. Basically all social and career responsibilities are lost. Continue to use even it cause problem in relationship. Chalo. Then giving up social, occupational and recreational activities. তাহলে social activities মানে ঠিক আছে, occupational workspace and recreational মন ভালো করার জন্য যা কিছু। ঠিক আছে? Using substance again and again even when it puts you in danger. তাহলে the substance is causing distress or illness or problem but the person is continuing to use it. Then continue to use even when you know you have a physical or psychological problem that could have been caused or made use by substance use. এদিকে আয়। বসতে দেখতে পাচ্ছিস না তুই? দেখে নিচ্ছিস, ঠিক আছে। Then tolerance. What is tolerance? বল, অভিক বল। What is tolerance? Hey, tolerance comes as a short note. বল। কে বলতে পারবে? সাজদা বাইরে। Tolerance মানে the amount of drug required to produce a desired effect is higher. ঠিক আছে? You need a higher amount of drug to produce a desired effect. That is tolerance. A tolerance comes as a short note. ঠিক আছে? So tolerance, withdrawal symptoms. So your body is wired in such a way, it get adapted to the drug in such a way that if the drug is not supplied to the body, there will be violent reaction. Now there are 11 criteria. Out of these 11 criteria, if 2 are positive, then it is said to be mild substance use. If four or five are positive, then it is said to be moderate. দরজাটা বন্ধ করে এখানে গেবার পাশে if 4 or 5 is positive, then it is moderate. If 6 or more than 6, it is severe. তাহলে DSM 5 কি হলো? So large amount of substance, repeated time, then spending a lot of time on getting the substance, craving, not manage to do what is desired, continue to use even in problem with relationship, social, occupational and recreational activity, using substance again and again even it is put you in danger. দেরি করে এসছে diagnostic and statistical manual for mental illness 5 মানে 5th edition, ঠিক আছে? এটা এরা ইউজ করে, সাইকিয়াট্রি লোকজন ইউজ করে, ঠিক আছে, ফর ডায়াগনোসিস অফ মেন্টাল ডিজিজ। বুঝেছিস? টলারেন্স and then withdrawal symptom. Now how to prevent the misuse of drug? One part of it, there are some legal remedies. Drug বিক্রি করা যাবে না, you put a limitation on the availability of the drug or to whom the drug is to be sold. Another part is the educational part, patient education. So the society or the patient as a whole should be educated about the ill effect of drug. ঠিক আছে? Drug labeling. If there is chances of a patient getting addicted, that must be properly labeled within the drug, within the packaging of the drug. Package insert, দেখেছিস package insert? Seen package insert? Package insert. Heard of the term? No. So within the packaging, there is a strip of paper or a tiny booklet that contains the pros and cons of drugs. That is a package insert. ঠিক আছে? Counseling by doctors, nurse and pharmacists about the ill effect of drug misuse. Certain rules and regulation, drug and cosmetic acts, drug and cosmetic rules. Schedule H. Heard of this thing? Schedule H? So in the drug, there will be labeling. এখানে বস। There will be a lead color labeling stating Schedule H. Schedule H means to be sold under presence of prescription. Schedule G, a restricted cell. ঠিক আছে? And the drug that don't require a prescription, generic drug means that it does not contain any branded name. So what is the drug that is being used, that is being sold? Over the counter drug. Over the counter drug. Easily sold. Paracetamol. That does not have much of a restriction. There are some rules and regulations regarding the sale of drug. That is the legal part of it. Then type of tolerance. Type of addiction. Addiction may be physical and psychological. ঠিক আছে? Physical means there will be withdrawal symptoms. The body is addicted to drug in such a way that its physiology is altered. It requires the drug, otherwise there will be violent reaction. ঠিক আছে? Example, opioids. ঠিক আছে? Alcohol, barbiturates, benzodiazepine. Psychological, it does not produce that amount of change in the physiology of the body. ঠিক আছে? Example, amphetamine, cocaine, cannabis. Cannabis মানে গাঁজা. গাঁজা, LSD. LSD is a hallucinogen. ঠিক আছে? Caffeine, where is it found? Coffee, cha. ঠিক আছে? Carbonated drinks. ঠিক আছে? All this contains this caffeine. Cocaine, mechanism of action, a local anesthetic হয়ে গেছে. Mechanism of action of cocaine. ভুলে গেলে কি করে হবে? নুরুদ্দিন বল। inhibit reuptake of noradrenaline, all monoamines. ঠিক আছে? noradrenaline, dopamine সবকিছু reuptake inhibit করে. It is also used in local anesthetic. ঠিক আছে? amphetamine, mechanism of action না, ঠিক আছে? So physical, there is intense craving for drug, then tolerance invariably present. So if a addict is taking suppose 1 gram of drug, then you need to gradually increase the dose to get the same euphoric state. ঠিক আছে? Addiction is for the state of euphoria. ঠিক আছে? So it requires increased level of drug to produce the same euphoric state. So tolerance in opioid, what get tolerated and what does not? Constipation does not get tolerated. Euphoric state gets tolerance. ঠিক আছে? What is cross tolerance? Cross tolerance, anyone? Cross tolerance? What? No, same species na. What he is telling is correct, that one drug will produce tolerance for another drug, that is cross tolerance. ঠিক আছে? আর mechanism of tolerance, how tolerance occur? What? When there is excess of drug, there will be receptor down regulation. ঠিক আছে? And there will be increase in metabolism. It may induce enzyme that may leads to increase in metabolism. That leads to tolerance. Tolerance will be invariably present. Withdrawal effect are severe. ঠিক আছে? So you must provide the drug to prevent withdrawal. Now, when these addicts get arrested and it's put behind the bars, the police have to arrange for the drug. ঠিক আছে? If drugs are not given, the addict may die, and the police will be responsible for death. ঠিক আছে? Maybe if the person is taking suppose 100 gram of drug, maybe he has to be supplied 70 gram, but that has to be supplied. So the heading is wrong. It is not physiological, it is psychological. ঠিক আছে? Psychological tolerance, psychological dependence. Example, tea, coffee, these are all psychological dependence. So moderate or compulsive drug seeking behavior. So it won't be intense drug seeking behavior like that of opioid. ঠিক আছে? অনেকে চা না খেলে সকালবেলায় ভালো লাগে না। ঠিক আছে? Tolerance virtually not present. You don't get tolerance by having tea. ঠিক আছে? You don't need 2 cups of tea if you are having one. So how will we manage a patient which is having addiction? First and foremost, education and social awareness. The most important part. Education and social awareness. So prevention is the best cure. So society as a whole and the individual need to be taught about the ill effect of drug. If a addicted person does not want to leave his addiction, nothing can make him leave addiction. First and foremost, the addicted person must want to leave his addiction. ঠিক আছে? Then psychosocial intervention. So basically counseling by psychiatrists or psychologists about the ill effect of drugs. Now we come to the pharmacological part. Substitution. So the normal physiology of the body is such that it requires the drug anyhow. So you have to substitute that drug by something else so that it won't produce withdrawal effect, but it won't produce the excitement either. So there won't be any euphoria, but the withdrawal effect will not be present. That is known as substitution. ঠিক আছে? Then gradual withdrawal. If a person is taking 100 gram of drug, we slowly decrease his dose to 90, then to 80, then to 70. Slowly and gradual withdrawal, so that the withdrawal effect may not be prominent. Then aversion. You have to put something in it so that the euphoria that is there won't be there. On the contrary, there will be something which will make him run away from the drug. So what is disulfiram reaction? ঠিক আছে, মিথাইল না, ইথাইল অ্যালকোহল, মিথাইল অ্যালকোহল খেলে মরে যাবে, ঠিক আছে। So ethyl alcohol is metabolized by alcohol dehydrogenase and then by aldehyde dehydrogenase. First by alcohol dehydrogenase to produce the ethyl aldehyde, then to acetic acid, aldehyde dehydrogenase, ঠিক আছে। So this disulfiram or metronidazole, it blocks aldehyde dehydrogenase, ঠিক আছে। When aldehyde dehydrogenase is blocked, acetaldehyde will start accumulating within the body and that produce vomiting, tremendous amount of uneasiness, ঠিক আছে। That is known as disulfiram reaction. So that is an example of aversion, ঠিক আছে। So if a person having alcohol is made to take metronidazole or disulfiram, he will be averted to alcohol. রাস্তায় টানানো থাকে, গোপনে মদ ছাড়ান, ঠিক আছে। So they mostly use this technique of aversion, but that is not a good technique. Prevention of relapse. Now once the person is detoxified, he or she will have a inherent attraction towards that drug, ঠিক আছে, পুরোনো দিনের অভ্যেস। So relapse means again falls into the addiction, ঠিক আছে। So there must be some medication for prevention of relapse. And lastly, the most important part, psychotherapy, rehabilitation, occupational therapy. Now why does this addiction take place? One is there is too much of stress, ঠিক আছে। Another, there is curiosity for inhibited substances, ঠিক আছে। Most importantly, there is peer pressure. Peer pressure মানে বন্ধুরা খাচ্ছে আমিও খাবো, ঠিক আছে। Then there is this false narrative. This false narrative or this false picturization has been given that in movies, to become cool, having drug is to become cool. A false narrative has been given by the movies, by various influential personalities, ঠিক আছে। Or there may be some trauma due to war, দেবদাস হয়ে গেছে, ঠিক আছে, anything like that. So in any case, when the person is completely detached from the society, he must be given rehabilitation. When he or she is detoxified and his addiction is gone, there must be occupational and social rehabilitation. He must be put into some useful role in the society, or else all the factors that has been causing the addiction is still there. কিছু পেলো না, আবার যেখানে ছিল সেখানে গিয়ে ভিড়ে গেল, ঠিক আছে, are still there. So it's an important part, occupational therapy and rehabilitation, proper role into the society. Opioids, well, usual, myocardial infection, diarrhea, diarrhea, analgesic, ঠিক আছে, post operative pain, আর trauma. Which trauma you would not use this opioid? Head injury, ঠিক আছে, কেন? আর ঠিক আছে, আর so why opioid is not used in head injury is asked in examination, ঠিক আছে, short note কিংবা explain why দিয়ে আসে। আচ্ছা, myocardial infection, why? কেন কেন? Which pain is opioid used in? Opioid is used in which type of pain? No. Classify pain. The aching pain, ঠিক আছে, visceral pain. Opioid is used in visceral pain, ঠিক আছে, আর কি পেইন আছে? There is neuropathic pain, ঠিক আছে, then there is pain due to inflammation, ঠিক আছে। Opioid is given in dull aching pain, ঠিক আছে, visceral pain basically। আচ্ছা, intraoperative analgesia, বল কিছু opioid used in intraoperative analgesia। ওই জেনারেল অ্যানেস্থেসিয়া হয়ে গেছে না, তাহলে বল ঘড়ি বল, প্রোপোফল, জেনারেল অ্যানেস্থেসিয়া বুঝি আমি ওপিয়াইড বলেছি। ফেন্টানিল নাম শুনেছি? ফেন্টানিল ইজ এপিডেমিক ইন ইউএস, ঠিক আছে, ইউজড ইন জেনারেল অ্যানেস্থেসিয়া। malignant tumor, ক্যান্সারের ব্যথা কমানোর জন্য, স্পেশালি the metastasized one that metastasize to the bone, there is tremendous amount of pain. So opioid is used in conditions, ঠিক আছে, but opioid is not available in all stores. In all medical stores it is not available. There is availability in selective stores, and that too it is being given on specially prescribing the medication. দেখেছিস opioid কেউ? কয়েকটা opioid এর নাম বল। মরফিন, আর 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 the another lesser known use is cough suppression, ঠিক আছে, codeine use করে typically. Cough syrups are being used for addiction, না codeine থাকে, আরো অনেক, ঘুম পায়, ঠিক আছে, ঘুম পায় is also used by addict for addiction. কাফ সিরাপ পাচার হয়, দেখেছিস? রিসেন্ট না, বহুদিন ধরে পাচার হয়। So these are use of opioid. আমি পড়িয়েছিলাম তো opioid। তাহলে there is something known as reward center, বল what is reward center? Reward center, ওই আমি পড়িয়েছিলাম, মনে আছে কি পড়িয়েছি সেটা মনে নেই, তো মনে রাখবি না, তা আমি কি পড়িয়েছি সেটা তো মনে রাখবি, কবে পড়িয়েছি ডেট মনে রাখতে হবে না, কি পড়িয়েছি সেটা তো মনে রাখবি, তো অসুবিধা হয়ে যাবে পরীক্ষার সময় কি করবি। So there is this ventral tegmental area, this is the reward center, ঠিক আছে, it gives up dopaminergic fiber in nuclear accumbens, ঠিক আছে, when the reward center gets stimulated it releases dopamine, this is the mesolimbic pathway, ঠিক আছে, it releases dopamine in the nucleus accumbens. So why is this reward center there? কেন হঠাৎ করে ইউফোরিয়া দরকার কি, বল হঠাৎ করে ইউফোরিয়ার দরকার কি, হ্যাবিট তৈরি, হ্যাঁ ডিপ্রেশনে থাকলে যখন so this good sensation কেন, so this reward center is present to reward you for maintaining the normal physiological conditions. Suppose you are hungry, ঠিক আছে, so your body needs food, তখন কি হবে, রিওয়ার্ড সেন্টার বন্ধ হয়ে যাবে, so you start to feel uneasy, ঠিক আছে, getting what I'm saying, uneasy, ঠিক আছে, there is hypoglycemia, there is need for food and you are not getting one, so the reward center stops, then you are having food, ভালো করে পেট পুরে খেলাম, reward center starts to discharge again, that produces this satisfaction, ঠিক আছে, that is why the reward center is there, নেশা করার জন্য নয়, when you are doing when anybody is addicted basically he is cheating the reward center, ঠিক আছে, then there is connection to the frontal and prefrontal cortex. Prefrontal cortex is for is about behavior, cognitive behavior, ঠিক আছে, when there is addiction there will be behavioral change, there will be behavior for seeking of drug, a person will start to search for drug nahi, steal, do a robbery, anyhow and everyhow you will start to get the drug, make attempt, ঠিক আছে, then আর কোথায় ডোপামিন আর কোথায় এ করে, সাবস্টেন্সিয়া নাইগ্রা, সাবস্টেন্সিয়া নাইগ্রা কি কিসের জন্য করে, motor movement, ঠিক আছে, so these are the two places where dopamine become important. Dopamine used as therapy in Parkinsonism, dopamine therapy is very useful, এটা কি করে, এটা সব কিছুতেই অনেক কিছুতেই ডোপামিনের ইয়ে আছে, হিয়ার and in substantia nigra, ঠিক আছে, so basically this reward center, so any addictive substance activates this reward center, ঠিক আছে, to produce discharge into the nuclear accumbens, ঠিক আছে, that produces euphoria, that leads to addiction. Hey, Harshvardhan, you getting it? ঘুমোচ্ছিস? ঘুমোচ্ছে। So what are the effect of opioids? বল, কে বলবে? আসিফ বলবে, বল। withdrawal না, এফেক্ট বলেছে। হ্যাঁ, কনস্টিপেশন। আর বল, দীপশিকা বলবে। হ্যাঁ বল, কনস্টিপেশন, দেন হ্যাঁ অ্যানালজেসিয়া, ঠিক আছে, তারপর সালদেবা, এফেক্ট অফ opioids. ঠিক আছে, তো এফেক্ট অফ হোয়াট ইউ আর opioids কি? It produces analgesia first and foremost, ঠিক আছে, then cuff sensation is cuff centers are, yeah, ঠিক আছে, cuff centers are suppressed, then it leads to vomiting, then it leads to respiratory suppression, ঠিক আছে, পুরো যেটা বললো constipation, ঠিক আছে। So what will happen if opioids are stopped? Will start to, the exact opposite things starts to happen. Here, pain, hyperventilation, coughing, mydriasis. Opioid থাকলে কি হয়? Opioid কি করে? এই ছোট হয়, মায়োসিস, হ্যাঁ, ঠিক আছে, এখানে মিডিয়াসিস হবে, দেন হাইপারটেনশন, ডায়রিয়া, ইট ইউজ টু কজ constipation, then dysphoria means opposite of euphoria, ঠিক আছে, agitation, piloerection, ঠিক আছে, these are all withdrawal symptoms of opioids. তাহলে how to combat this withdrawal symptoms? First, we'll get to the substitution. Substitution means you put something that will prevent the withdrawal symptoms but will not produce euphoria. Methadone is an opioid, a long acting opioid. What methadone does, it goes and occupies the opioid receptors. Types of opioid receptors, mu kappa delta, ঠিক আছে, it goes and occupies the opioid receptors. তাহলে কি হবে? Opioid, it won't produce any fresh euphoria. Euphoria is produced when there is intake of opioid. That opioid goes and stimulates the receptor, that leads to sensation of euphoria. Now because methadone being an opioid agonist, receptor agonist, it goes and blocks the opioid receptor, ঠিক আছে, when the person takes opioid it won't produce any euphoria, but because it's an agonist it will produce the other effect that are there in opioid, ঠিক আছে। তাহলে withdrawal symptoms এর কি হবে? আরাত্রিকা, হ্যাঁ, withdrawal symptoms won't be there, ঠিক আছে, withdrawal symptoms হচ্ছে না, ইউফোরিয়াকে বন্ধ করে দিচ্ছে, নতুন ড্রাগ যখন নিচ্ছে there won't be any euphoria. This is substitution. This is another congener of methadone. Buprenorphine has a similar effect. Sajdeva, are you getting it? Huh? Sleeping? আসছি তো। ন্যালক্সিন কি? হোয়াট ইজ ন্যালক্সিন? বল। কি কি হিসাবে ইউজ করা হয়? হ্যাঁ, ওটা কি করে? হোয়াট ইজ ন্যালক্সিন? অ্যান্টাগনিস্ট, ঠিক আছে। ইটস এ রিসেপ্টর অ্যান্টাগনিস্ট। মিথাডোন ইজ আ রিসেপ্টর অ্যাগনিস্ট, ঠিক আছে। ন্যালক্সন ইজ আ রিসেপ্টর অ্যান্টাগনিস্ট। তো অ্যান্টাগনিস্ট দিলে কি হবে? হ্যাঁ, আর হোয়াট অ্যাবাউট উইথড্রল সিমটমস? হ্যাঁ, উইথড্রল সিমটমস আরো বেড়ে যাবে। পাচ্ছে না তো, the receptors are blocked, ঠিক আছে। So withdrawal symptoms will exaggerate. Naloxone, and what is the naloxone is a short acting one, naltrexone is a long acting one. Naloxone এ frequent dosing করতে হয়, naltrexone এ একবার দিলে অনেকক্ষণ চলে। So long acting opioid, ঠিক আছে। So when are we going to give the receptor antagonist? Number one, acute poisoning এ, ঠিক আছে, there is huge amount of opioids in the body. Number two, when there is detoxification, complete detoxification, there is no withdrawal symptoms present. This naltrexone, because it's a long acting one, is being given. Cannot given, it blocks the opioid receptor. So even if the person tries to get opioid, মানে opioid খেয়ে নেশা করতে যদি চায়, get addicted by taking opioid, he won't be able to do so, ঠিক আছে। So basically acute poisoning and to prevent relapse, বুঝলি? This is not an medication for withdrawal. Supportive therapy, clonidine. Clonidine কি করে? Mechanism of action.
Pre-junctional alpha receptor.
হ্যাঁ,
Pre-junctional alpha receptor.
কি কোন আলফা?
Alpha 1B1.
না, বল অনুষ্কা বল। আলফা 2 রিসেপ্টর, ঠিক আছে। দিস ইজ আ ইনহিবিটরি রিসেপ্টর, ঠিক আছে। preganglionic inhibitory receptor. So what does alpha 2 receptor does? It prevents the secretion of neurotransmitter. So during withdrawal, there is this huge sympathetic overdrive. There is this huge sympathetic outflow that is being prevented by clonidine. বুঝলি? Loxapidine is the same thing, it's a longer acting one, ঠিক আছে। Then we come to our second drug of abuse, alcohol, used as beverage, produce physical dependence, causes withdrawal symptoms. কি হয় অ্যালকোহলে? মেকানিজম আমি তোকে জিজ্ঞাসা করিনি, মেটাবলিজম জিজ্ঞাসা করিনি, মেকানিজম। হ্যাঁ, NMDA রিসেপ্টর, ঠিক আছে। So it produces action on GABA A receptor. The action is produced by increase in GABA release. Produces action on GABA A receptor. GABA A receptor কোথায় পড়েছিস? benzodiazepine কি করে GABA A receptor? Chlorine uptake. So it causes opening of the chlorine channel that leads to hyperpolarization, ঠিক আছে। That's how GABA A receptor acts. তাহলে GABA A receptor act করলে কি হবে? ইনহিবিটর নিউরনটা তো ইনহিবিট হয়ে গেল, ঠিক আছে। গাবায় রিসেপ্টর কি কাজ করে? আরে কি করে? প্রডিউসেস স্লিপ, ঠিক আছে, তাই তো? হ্যাঁ হ্যাঁ, প্রডিউসেস স্লিপ, ঠিক আছে, প্রডিউসেস লস অফ অ্যাংশিয়াসনেস, অ্যাংজিওলাইটি, তাই তো? দেন inhibits NMDA receptor. NMDA receptor responsible for hey, NMDA receptor is responsible for memory, responsible for muscular activity, ঠিক আছে। So in NMDA receptor inhibit হলে কি হবে? What will happen if the NMDA receptor is being inhibited? Memory loss, হ্যাঁ, কাজ করতে পারবে না, টলতে টলতে যাচ্ছে, ঠিক আছে। there is loss of muscular function, ঠিক আছে। release endorphin. What is endorphin? Enkephalin কি? opioid, endogenous opioid, ঠিক আছে, endogenous opioid, so that again cause the euphoria, ঠিক আছে। তাহলে যখন when the alcohol is withdrawn তখন কি হবে? what will happen? anxiety, তারপর হ্যাঁ ট্রেমার, ঠিক আছে, সোয়েটিং, হ্যাঁ withdrawal symptoms এর কি হবে সেটাই তো আমি জিজ্ঞাসা করছি, ডিটেইলসে জিজ্ঞাসা করছি। গাবায় রিসেপ্টর ইনসোমনিয়া হয়ে যাবে, অ্যাঙ্গার, অ্যাংজাইটি বললো তো কেউ একটা, তুই বললি না, অ্যাংজাইটি, ঠিক আছে, and loss of euphoria. There are other symptoms also, like there is hallucination, ঠিক আছে, convulsion, দেখেছিস অ্যালকোহল উইথড্রল? হ্যাঁ, কোথায় দেখেছিস? হ্যাঁ, ঠিক আছে, অ্যালকোহল উইথড্রল হলে কনভালশন হয়, ঠিক আছে। since GABA receptor is being activated by alcohol, ঠিক আছে, so there is convulsion. Other effect, pancreatitis, cirrhosis of liver, gastritis, vitamin deficiency, ঠিক আছে। gastritis, pancreatitis, one of the most common cause of pancreatitis is due to alcohol. Then depression, ঠিক আছে, when the alcohol level in the blood starts to fall, the euphoria erodes, so there is depression. There is something known as alcohol blood concentration, ঠিক আছে, measured in grams per 100 ml, gram percent, ঠিক আছে। in concentration of 0.02 there is feeling of euphoria, then from 0.05 there is this loss of inhibition. What do you mean by loss of inhibition? No. So you are behaving in such a way in a society because there are some norms, that norms is lost. Then 0.08 there will be motor incoordination, টলতে টলতে যাচ্ছে, 0.08, আগেরটা কি বলছে 0.05, ঠিক আছে, concentration, ঠিক আছে। then 0.1 there is severe incoordination of motor and there is slurring of speech. Then cardiomegaly, arrhythmia, there is something known as holiday heart syndrome, excess of alcohol, sudden arrhythmia and death. Vomiting, malady wise tear. So there is excess of purge leading to tear of esophagus, that is known as malady wise tear. Huh? Purge, excessive purge. Purge মানে জোরে বেরোচ্ছে, ঠিক আছে? তাহলে that leads to tear of the esophagus known as malady wise tear. Cancer of oral cavity, esophagus, breast and rectum. And then there is this fetal alcohol syndrome. It has teratogenic effect. ঠিক আছে? So how to detoxify alcohol? Long acting benzodiazepine, chlordiazepoxide. ঠিক আছে? It's not that the short acting one won't work, diazepam and lorazepam, but they have to be dosed frequently. So this long acting diazepam is used. এটা কি হচ্ছে? This is a substitution of GABA A receptor. তুই বুঝতে পারছিস? কিছু প্রবলেম হচ্ছে মুস্কার। Then clonidine আবার alpha 2 agonist. Disulfiram, just now we have discussed. So disulfiram is a produces, ঠিক আছে, mechanism ঠিক আছে, it is produce this distasteful syndrome. তাহলে disulfiram কখন দেওয়া হবে? Suppose there is some special occasion, suppose New Year, when people are drinking more, so disulfiram is being given. তাহলে কি হবে? There is least chance of relapse. বুঝলি? Relapse will stop. The chances of relapse will be lower. Naltrexone, we have discussed. Opioid receptor blocker. ঠিক আছে? SSRI 5-HT3 antagonist. Topiramate is also used. Acamprostate is a NMDA receptor blocker. ঠিক আছে? Then multivitamins. Now one of the prominent symptoms of alcoholics are they are folic acid, now multiple vitamin B complex deficiency থাকে, ঠিক আছে? One of the causes there is decreased absorption in the GI tract. Another cause is there may be the person may be indifferent to himself or herself, ঠিক আছে? ঠিকঠাক করে খাচ্ছে না, that may lead to vitamin deficiency. So you must give one supplement of multivitamin. When there is an alcohol poisoning or there is excess of alcohol intake, you give this vitamin supplement, multivitamin supplement. Now next, barbiturates. The same thing. Barbiturates কি করে? সিরেটিক হিপনোটিক, ঠিক আছে? তাহলে barbiturates acts on GABA A receptor. অন্য সাইটে থাকে, ঠিক আছে? So barbiturate also cause addiction. তাহলে কি করতে পারি? Short acting barbiturates are substituted by long acting one. The mechanism is same, ঠিক আছে? Gradual withdrawal. So you decrease the dose steadily. Then alkalization of urine. So what is barbiturates? What is the chemical nature of barbiturates? Barbituric acid. Barbituric acid বলে তো, ঠিক আছে? Acidic in nature, and in alkaline urine it will remain ionized. So reabsorption will be low. So there will be more of excretion in kidney. Metabolic acidosis এ যাচ্ছি, ঠিক আছে? Substituted with antihistaminics, diphenhydramine, that produce especially the first generation antihistaminic. First generation antihistaminic causes sedation, ঠিক আছে? Seizure control by benzodiazepine. তোরা কি করছিস? হ্যাঁ, দেখেছি। Benzodiazepine prolonged used in high dose, so substituted by long acting benzodiazepine. Fumazolin is a receptor antagonist, ঠিক আছে? আমাকে বলেছে 3টের মধ্যে ক্লাস শেষ করে দিতে। Smoking substituted by nicotine gum, ঠিক আছে? Then bupropion, farnesylin, clonidine, these are all being used as farnesylin is a nicotine receptor agonist, ঠিক আছে? Partial agonist. Bupropion, clonidine, these are all used for cessation of smoking. So Nesha Mukto Bharat, it's a program used by launched by Government of India for rehabilitation of the addicted persons. So it's a campaign done by Kolkata Police for prevention of addiction. So every year 26th of June is being celebrated as a day against illicit drug use and trafficking, human trafficking. So this year the theme was evidence is clear in prevention. So prevention is the best cure, ঠিক আছে?